The vital role of minerals in diabetes management, beyond medication. If you're managing diabetes, you've likely been told to watch your carbs, take your medication, and monitor your blood sugar religiously. But there's a crucial aspect of diabetes care that often goes unnoticed: minerals. These essential nutrients play a fundamental role in how well insulin works in your body and how effectively you can prevent complications. Today, I'll take you through an in-depth examination of the three most critical minerals for diabetes management: selenium, manganese, and calcium, and why they deserve your attention. Many diabetics are unknowingly deficient in these minerals, which can significantly impact their health outcomes. Why minerals matter for diabetics. Before diving into specific minerals, let's understand why minerals are so vital for diabetic health. Minerals function as cofactors for enzymes involved in glucose metabolism and insulin signaling. They also support antioxidant defense systems that protect against oxidative damage caused by high blood sugar. Research published in the Journal of Clinical Endocrinology and Metabolism suggests that mineral deficiencies may contribute to insulin resistance and worsen diabetes complications. A comprehensive review in Nutrients found that addressing specific mineral deficiencies improved glycemic control in type 2 diabetics. Selenium, the overlooked protector. What makes selenium essential for diabetics? Selenium may not get much attention, but for diabetics, it's indispensable. This powerful mineral supports glucose metabolism, insulin sensitivity, nerve function, heart health, antioxidant defense systems. The challenge is that selenium levels are declining due to soil depletion, poor dietary choices, and the metabolic effects of diabetes itself, which impair absorption and retention. The selenium absorption challenge. It's not just about how much selenium you consume, it's about how effectively your body can use it. Several factors affect selenium absorption in diabetics. Chronic high blood sugar increases oxidative stress, depleting selenium reserves. Elevated insulin levels reduce selenium absorption. Gut health issues like inflammation or leaky gut compromise selenium uptake. Some diabetes medications, particularly metformin, can interfere with mineral absorption. The wide-ranging impact of selenium deficiency. Selenium deficiency affects numerous body systems. Brain and mental health. Low selenium levels can increase anxiety and depression by disrupting neurotransmitters like serotonin and dopamine. Reproductive health. For men, selenium deficiency can lead to reduced sperm count, lower testosterone, and erectile dysfunction. For women, it can cause hormone imbalances, irregular periods, and fertility challenges. Nervous system. Selenium is essential for myelin production, the protective coating around nerve fibers. Deficiency can contribute to neuropathy symptoms like numbness and tingling. Kidney function. Selenium-based antioxidants help prevent glucose-related kidney damage. Vision. Adequate selenium helps protect against diabetic retinopathy. Cardiovascular health. Selenium supports vascular health. Low levels are associated with hypertension, arterial stiffness, and increased heart disease risk. How selenium improves insulin function. At the cellular level, selenium helps activate GLUT4 transporters, which move glucose from the bloodstream into muscle and fat cells. This directly helps lower insulin resistance. Selenium also regulates inflammation, reduces advanced glycation end products, AGEs, that accelerate diabetic complications, supports thyroid hormones that help stabilize blood sugar. Best selenium food sources. While soil depletion has made getting selenium from food more challenging, these foods still offer significant amounts. Brazil nuts, 68 to 91 mg per nut, 125 to 165% of daily needs. Wild-caught salmon, 42 mg per 6 ounces, 76% of daily needs. Sardines, 45 mg per 3.5 ounces, 82% of daily needs. Pasture-raised eggs, 22 mg per egg, 40% of daily needs. Grass-fed beef liver, 36 mg per 3 ounces, 65% of daily needs. These foods also contain nutrients that enhance selenium absorption, such as vitamin E, healthy fats, and amino acids. Selenium supplements. If dietary intake is insufficient, supplements may be beneficial. The two most effective forms are selenium yeast, 200 mg per tablet, mimics the natural form found in food. L-selenomethionine, 200 mg per capsule, highly absorbable and works well for those with digestive issues. Foods that worsen selenium deficiency. Certain foods can block selenium absorption or increase its excretion. High-sugar diets deplete selenium through increased oxidative stress. Processed grains lack selenium. Unfermented soy products contain phytic acid that binds to selenium. Alcohol depletes selenium in the liver. High-mercury fish bind selenium, making it unavailable. Manganese, the blood sugar stabilizer. Why manganese matters for diabetics. Manganese might not be the first mineral you think about for diabetes management, but its impact on blood sugar, nerve health, and inflammation is significant. Unfortunately, soil depletion, processed diets, and accelerated urinary excretion due to high blood sugar mean many diabetics are deficient. Signs of manganese deficiency. Manganese deficiency develops gradually with symptoms including low energy levels despite adequate sleep, mood swings, irritability, anxiety, or mental fatigue, hormonal imbalances affecting both men and women, nerve issues like tingling, numbness, or burning sensations, kidney vulnerability to oxidative damage, increased risk of diabetic retinopathy, cardiovascular issues including arterial stiffness and hypertension. Manganese's cellular role in diabetes management. At the cellular level, manganese activates MNSOD, manganese superoxide dismutase, one of the body's most powerful antioxidant enzymes that protects insulin-producing beta cells. Activates glucokinase, an enzyme controlling glucose uptake into cells. Helps prevent blood sugar fluctuations. Supports energy production. Manganese's cellular role in diabetes management. At the cellular level, manganese activates MNSOD, manganese superoxide dismutase, one of the body's most powerful antioxidant enzymes that protects insulin-producing beta cells. Activates glucokinase, an enzyme controlling glucose uptake into cells. Helps prevent blood sugar fluctuations. Supports energy production. Calcium, beyond bone health. Calcium's critical role for diabetics. While most associate calcium with bone health, it's essential for nerve function, heart health, muscle contractions, and blood sugar control. Many diabetics are deficient due to chronic inflammation, kidney issues, and medications that interfere with absorption. Signs of calcium deficiency. Calcium deficiency develops gradually with signs including muscle cramps, especially in the legs. 68% of people with chronic leg cramps had low calcium levels. Mood swings, anxiety, and depression. 35% higher risk of mood disorders with low calcium. Sleep problems. 42% more likely to suffer from insomnia. Reproductive issues in both men and women. Nervous system problems, increasing the risk of neuropathy. 48% higher risk in diabetics with calcium deficiency. Kidney function decline and increased risk of kidney stones. 27% higher risk. Eye issues including increased risk of diabetic retinopathy, 33% higher chance. Cardiovascular problems, 40% more likely to develop hypertension, 25% higher risk of arterial stiffness. Calcium's role in blood sugar regulation. Calcium is crucial for insulin release from pancreatic beta cells, activation of GLUT4 transporters to move glucose into cells, mitochondrial ADP production. Best calcium food sources. Top sources include sardines with bones, 325 mg per 3.5 ounces, 33% of daily needs. Collard greens, 268 mg per cooked cup, 27% of daily needs. Almonds, 76 mg per oz, 8% of daily needs. Canned salmon with bones, 180 mg per 3.5 ounces, 18% of daily needs. Parmesan cheese, 331 milligrams per oz, 33% of daily needs. Calcium absorption considerations. Not all calcium sources are equally bioavailable. Dairy and fish with bones, 30 to 40% bioavailable. Leafy greens, 20 to 30% bioavailable. Nuts and seeds, 10 to 20% bioavailable. Calcium supplements. For those needing supplementation, calcium citrate, 500 milligrams per capsule, absorbs well even without food. Calcium hydroxyapatite, 600 milligrams per dose, includes natural phosphorus and collagen. Factors that deplete calcium. Be mindful of. High sodium processed foods increase calcium loss through urine. High phosphorus foods interfere with calcium absorption. Excessive caffeine increases calcium excretion. Oxalate-rich foods can bind calcium and reduce absorption if eaten in excess. Maria's journey, reversing neuropathy through mineral balance. Maria, a 58-year-old teacher who had been living with type 2 diabetes for 12 years, came to me with increasing neuropathy symptoms. Despite following her medication regimen, she experienced constant burning and tingling in her feet that was beginning to affect her daily activities. After a comprehensive assessment, we discovered severe deficiencies in selenium and manganese. We implemented a 3-month plan focusing on mineral-rich foods and targeted supplementation. Her typical day included: breakfast, oatmeal with Brazil nuts, cinnamon, and berries. Lunch, wild salmon with spinach salad and pine nuts. Dinner, grass-fed beef with collard greens and wild rice. Supplements, selenium, 200 mg, and manganese glycinate, 5 mg, daily. After 3 months, Maria reported an 80% reduction in neuropathy symptoms. Her HbA1c dropped from 7.8% to 6.5%, and her inflammation markers decreased significantly. I never realized how important these minerals were, Maria told me. My doctor had never mentioned them, but addressing these deficiencies made a bigger difference than any medication adjustment ever did. James's story, from fatigue to vitality. James, a 62-year-old executive with a 15-year history of diabetes, struggled with persistent fatigue despite good blood sugar control. His energy levels were so low that he was considering early retirement. Testing revealed significant calcium and selenium deficiencies. We developed a mineral-focused nutrition plan and supplement regimen. After 4 months, his energy levels increased by 70%. Sleep quality improved dramatically. Mental clarity returned. Blood pressure normalized without additional medication. I thought fatigue was just part of having diabetes and getting older, James said. Learning about these mineral connections has transformed my life. I'm back to working full days and even enjoying weekend activities with my grandchildren. The synergistic approach, how these minerals work together. While each mineral has distinct benefits, they work synergistically to support diabetic health. Research in the Journal of Trace Elements in Medicine and Biology demonstrates that the combined effect of adequate selenium, manganese, and calcium produces better outcomes than addressing any single deficiency. This synergy helps optimize insulin sensitivity, protect beta cell function, reduce inflammation, support antioxidant systems, prevent complications. Implementing a mineral-rich strategy. Getting started, a 30-day plan. To begin addressing potential mineral deficiencies. Week 1 to 2, assessment and baseline. Get proper testing for mineral levels if possible. Document current symptoms. Begin incorporating 1 mineral-rich food daily. Week 3 to 4, gradual implementation. Add 2 to 3 selenium-rich foods weekly. Incorporate 2 to 3 manganese-rich foods weekly. Include 2 to 3 calcium-rich foods weekly. Consider supplements if indicated by testing or symptom pattern. Daily tracking. Monitor blood sugar patterns. Note changes in energy, sleep, and neuropathy symptoms. Track medication needs. Beyond food, lifestyle factors that support mineral utilization. Certain practices enhance your body's ability to use these minerals effectively. Regular physical activity improves mineral transport into cells. Stress management reduces mineral depletion. Adequate hydration supports mineral transport. Quality sleep enhances cellular repair and mineral utilization. Limited alcohol consumption prevents mineral depletion. Common myths about minerals and diabetes. Myth number 1. I take a multivitamin, so I'm covered. Most standard multivitamins contain minimal amounts of these critical minerals, often in poorly absorbed forms. For example, many contain selenium as sodium selenite, which has lower bioavailability than selenomethionine or selenium yeast. Myth number 2. Mineral deficiencies are rare in developed countries. While severe deficiencies causing immediate symptoms are indeed rare, subclinical deficiencies affecting metabolic function are surprisingly common. Research in the American Journal of Clinical Nutrition found that over 50% of diabetics have at least one significant mineral deficiency. Myth number 3. My doctor would have mentioned this if it were important. Most medical education provides minimal training in nutrition, and even less in mineral biochemistry. A survey of physicians found that less than 15% routinely check for mineral status in diabetic patients unless severe symptoms are present. Myth number 4. High-dose supplements are always better. More isn't always better. Each mineral has an optimal range, and excessive intake can cause problems. For example, too much selenium can lead to selenosis, with symptoms including hair loss and neurological issues. Looking forward, the future of mineral therapy in diabetes. Emerging research is exploring targeted mineral therapy as an adjunct to conventional diabetes treatment. Studies are investigating personalized mineral supplementation based on genetic profiles, time-released mineral formulations for optimal absorption, mineral-enriched foods specifically developed for diabetics, biomarkers to better assess functional mineral status rather than simply measuring blood levels. Conclusion: a comprehensive approach. The management of diabetes requires a comprehensive approach that goes beyond medication and carbohydrate counting. The research clearly shows that selenium, manganese, and calcium play crucial roles in maintaining insulin sensitivity, protecting against complications, and supporting overall metabolic health. By addressing these often overlooked mineral deficiencies, many diabetics can experience significant improvements in blood sugar control, energy levels, and quality of life. The key is to focus on high-quality, bioavailable food sources while addressing factors that might impair absorption or increase excretion. Remember, small changes implemented consistently can lead to remarkable improvements over time. Start by incorporating one mineral-rich food into your daily diet, then gradually expand your nutritional approach. I encourage you to discuss mineral testing with your healthcare provider and consider how this aspect of nutrition might be affecting your diabetes management. Your path to better health may be influenced by these tiny but mighty nutrients more than you realize. If you found this information valuable, please take a moment to like this video and share it with someone who might benefit. The connection between minerals and diabetes management is information that deserves wider recognition. Have you noticed changes in your diabetes symptoms after adjusting your mineral intake? Share your experience in the comments below. Your story could help others on their healing journey. Don't forget to subscribe to the Health Fusion channel for more evidence-based insights on optimizing health naturally. Hit the notification bell so you don't miss our upcoming video on how specific herbs can enhance insulin sensitivity. Thank you for your attention, and here's to your vibrant health.